Senate. We bring in Congressman Phil Rowe, Republican congressman from Tennessee and co-chair of the Republican Doctors Congress. So you've got to wait, Representative Rowe, on, I guess, on the details until Thursday, correct?
That's correct. I think, Liz, we pretty much know what it is, the details to be worked out, and I think many members, more than 13, had input into this bill.
Hold on a second. You know pretty much what the details are? Can you share those with our viewers? Because it's sort of been behind closed doors.
It has been behind closed doors, but we know the parameters of which we're going to do. We're going to reform Medicaid. It's just how we do it. And we know that the Affordable Care Act can't continue like it is, at least in many states across the union. There are not many many options that people have. So we're going to reform that. That will look, I think, somewhat like the House version of the bill did.
When you say we're going to reform Medicaid, it's just the details of it. The way the Senate does it could drastically change how the House bill was planned. And yes, President Trump was very clear about a week ago today, I believe, where he said you've got to be more generous on the Senate side. You were able to pass a bill that would please the Freedom Caucus to get on board. If it all changes in the Senate markedly, what do you do next about that?
Well, I think we have to wait and see. Look, I think we need to have health care reform. We need to bring prices down and increase the number of people who are covered. Right now, Liz, we're seeing in my state decreasing numbers on the exchange. It hasn't gone up. The CBO estimated in 2010 there'd be 24 million people getting their insurance to the exchange. It's about 10. And the prices are going up. To where families cannot afford this without these very generous subsidies. So it has to be reformed. We don't have a choice.
You have centrist senators who right now are looking at least some of the issues that you passed in the House, and among them this ability for states to opt out, the waivers for states, and they can opt out of entire portions of the plan that you passed, and that could include covering pre-existing conditions for things like cancer and heart disease. That upsets people, and it apparently rankled President Trump. He didn't like the ability to do that. He wants those people covered.
Well, obviously, we all want those covered. If what you said were true, it would be a really bad bill. But that's not the case. If you are in the individual market or the small business market, which is about 7% of the population, and your state says it's going to waive the 8 essential, 10 essential health benefits, and you have a pre-existing condition, and you drop coverage, then you can have a problem, except we also have a plan to cover those folks. What we didn't want to have happen is where people dropping their coverage and then having guaranteed issue, making the rates much higher for everyone else. So that's what was happening. So
okay,
we've actually covered that.
Is that the deal breaker, doctor? And I never forget that you're a doctor, and you are the person that I would love, certainly anybody who's worked as a doctor, to be looking and picking through this thing. What is the deal breaker for you when it comes to the Senate plan? If they remove one thing that you say is hands off, what is that one thing?
You know, I think we'll all agree on pre-existing conditions. That's hands off. There's no question about that. That's already covered in Medicaid, Medicare, and the general insurance market. We already have that. It's only the individual markets. Be a hands-off thing for me. I think for all of us, I think 26-year-olds is going to stay in there, and I think guaranteed issue. If you keep continuous coverage, you have to get guaranteed issue.
Well, I'm glad at least you were a part of the discussion on the House side. We'll see what the Senate does Thursday. They're releasing that. Quickly before you go, we have Stephen Mnuchin, the Treasury Secretary, and Gary Cohn, the economic advisor to the president, right now writing up tax reform. If necessary, would you, and I'm not talking about you, the Republicans, would you personally, doctor, give up your August recess to work through it so that it's ready by the first 2 weeks in September?
Oh, absolutely. I think we need to do, look, Liz, as an OBGYN doctor, I've been used to working 60 to 80 hours a week. I think absolutely every member of Congress would be willing to give that effort. If we could jumpstart this economy and create jobs, lower the deficit, absolutely.
Well, that's news, and I hope you're speaking correctly for everybody, but good for you, doctor. Thank you so much.
Thank you. Thanks, Liz.
Congressman